Dr. Smolwud, it's good to have you on the newscast. We can see a big process of prevention against this new variant Omicron. As part of the emergency team of WHO, can you tell us how dangerous it is?
Good afternoon, good morning, and yes, we at WHO we declared this variant Omicron a variant of concern, and we did this on the 26th of November. Just as soon as we received information about it, because based on its mutation profile, it has some significant changes to the spike protein, which is the part of the virus that attaches itself to our cells and enables the virus to infect it. And this means that some of the mutations we know are associated with higher transmissibility, so the way the virus spreads between people. But other mutations are associated with immune escape. So that's the ability of the virus to reinfect people who have already had COVID-19 in the past, but also potentially to decrease the effectiveness of our vaccines. And that's what we're seeing played out now in Western Europe and in countries of Northern Europe that are really seeing very rapid transmission of Omicron. We're seeing that people who have already had COVID-19 cannot rely anymore on natural immunity or recovery. So it's really important that those people who have had COVID-19 in the past and think that they are protected, that they go and get vaccinated. But we're also seeing some people who have had vaccinations also be reinfected. But the good news is that in those people, it's really vastly mild disease. And we're not seeing in people who have had vaccination, people end up in hospital too often. However, that might be the case. But the most important thing is people end up protecting themselves, getting ready for the spread of Omicron across Europe, which we expect to happen in the next few weeks and months. And we do everything we can to protect ourselves, to keep COVID-19 transmission low. It's all the same rules and practices for all variants of COVID-19. So there's no change in the way that it spreads.
Dr. Smolwud, all that I can hear these days is that Omicron is trying to be faster than people who are going home for holidays. What is your advice for governments? Is it any way to prevent from spreading this variant?
Well, we've seen a lot of countries implement quite harsh travel ban measures, some against countries in Southern Africa, some even against countries in the European region. It's our view that these types of actions will not prevent the spread of this new variant. It's our assessment right now that Omicron is already widely dispersed in the European region and will be spreading first at very low levels, but then at increasing levels in communities across Europe. So it's really important that what governments do is keep transmission of COVID-19 as low as possible during this period. The assessment is that COVID-19 will have another resurgence because of Omicron, because it spreads so much better in our populations, and that we need to do everything we can to keep our cases low, to control that resurgence, and have it happen as slowly as possible.
Let's be useful for our audience. Is there any symptom which can be a sign of Omicron? How can we make a difference if we are infected?
It's very unlikely that people will be able to make a difference, and most of the signs and symptoms are the same as for COVID-19. And as we know, the signs and symptoms of COVID-19 in general can range from being extremely mild, like cold-like symptoms, to very, very severe, requiring hospitalization. And it's likely that we'll see the same for Omicron. So there's no change. It's not up to individuals to determine whether they've got Omicron or Delta, which is the dominant circulating virus of COVID-19 at the moment in Europe. But this can be measured in some of the testing that governments do. Really important that people go and get tested if they have signs and symptoms of disease. And then most important, especially if people are at high risk of disease, if you're over 60, if you have any comorbidities such as asthma or diabetes, that as soon as you have signs or symptoms, you get medical advice. But still, the most important message at the moment is for people to go ahead, get the vaccine, first dose. If you haven't already had the first dose, it's really important you go ahead and get the the second, and if invited to go and get a booster dose, that you do so. This is critically important, especially in people who are over 60, because it will prevent people from ending up in hospital for Delta and for Omicron.
As I understand from your previous answer, you said that even people who have been infected are not safer than others.
Absolutely. And WHO has recommended that people who have recovered from COVID-19 still go on to get vaccinated. It's really important that people understand that protection using the vaccine is much more effective than protection than having the disease and getting COVID-19 and assuming you're protected. Getting COVID-19 can mean that you're in hospital. It can mean that you have long sequelae and consequences of the acute disease that go on for months and months and months, even in young, healthy people. So getting vaccinated will protect you against the acute form of the disease, but also long COVID. So it's really important. And then particularly with Omicron, we see that there's a risk of perhaps 3 to 5-fold more of people getting COVID a second time because of its ability to evade our immune systems. And we're seeing that already. Many of the cases are in people who have had COVID before. Many of the cases are also in people who have had the vaccine. But this means that when people have had the vaccine, that they're protected against severe disease. And that's really where we have to keep our focus on right now. The vaccine is there not to prevent the transmission of COVID, it's to prevent people from dying from COVID. And that's the main purpose of the vaccine, and it will continue to do that job.
Yes, this was really honest, but why do we have a new vaccines that pharmacists are working on now? And are these that we are using now enough to protect us?
Yes, we're doing studies at the moment and we're still learning things every day. But it's very likely that the vaccines that we're using at the moment still protect us from hospitalization and death from Omicron, just as it did from Delta. There is some reduction in the protection against infection. So it's likely that people might still get COVID-19. But no vaccine is 100% effective. There is a drop in the effectiveness against Omicron, but there's maintenance and the protection against severe disease is still there. So it's still absolutely critical that people who are over 60 get vaccinated, because there may be a big wave coming with lots of infections, as we're seeing in countries like the United Kingdom, in Denmark. The systems are becoming overwhelmed because of the sheer number of cases. And it's really clear that what we expect to see is in populations that haven't got the same level of uptake as the UK and Denmark, there will be much higher mortality.
Dr. Smolvud, what is your opinion? Is it safe to vaccinate our kids?
WHO's recommendation at the moment is to really focus on vaccinating people who are at risk of severe disease. Mm-hmm. However, the vaccines, there are several vaccines that have been looked at for children, and there has been emergency listing in some parts of the European region, such as in the European Union, for use of Pfizer in 5 to 11-year-olds. That means that the European Medicines Agency has done rigorous studies to understand its safety profile in children, which is we understand to be very good. And it's decided that on a cost-benefit analysis that it makes sense to go ahead and vaccinate those children. It's not a concern of ours at the individual level that the vaccine will be unsafe in children. But for the moment, and especially with this Omicron variant, we really see it as most important that people at high risk of severe COVID get vaccinated. And in countries like North Macedonia, we're still not there yet. And that's really the step that people need to be taking right now.
Maybe this will be a hard question for you, but for how long we will fight with COVID? Is there any smart answer?
I get asked this question all of the time, and trust me, we're all sick of it. And I'm just as sick of it as everyone who's had their lives disrupted or have had their family members die of COVID-19. It's a terrible event. It's a natural pandemic. We know that these pandemics occur through history, and it's really up to us to change the course of the pandemic. And we will come out of it as a global community, as a human population together. And the impact that it will have on us will really depend on the decisions we take both at the government level, good policies are critical, and also at the individual level. So I can't tell you when it'll be over, but I can tell you that we do have the tools to get ourselves out of this terrible uncertainty. The use of the vaccine is critical. The use of good public health measures is critical. Widespread testing, access to services, the use of contact tracing and quarantine to interrupt transmission of the virus, and also the use of, I'm afraid, some measures that might affect our day-to-day lives. But at the individual level, wearing a mask, maintaining good physical distancing, ventilating indoor spaces, avoiding meeting people in crowded settings, especially if you're not understanding who you're meeting and what their vaccination status is. These are all things that are going to change the course of the pandemic. And to think that it's out of our control is a mistake. It's very much within our control. But we really, as a human population, for humanity, need to act together.
I need to ask you, since we are on the top of the list with mortality, after all of this, are you as WHO are going to inspect how patients are being treated? What is the reason for this?
There are lots of reasons for higher levels of mortality in countries. Some of it is related to the demographics, so the population demographics of a given country, the average age in populations. A lot of it is linked to the background health status of populations, if people are relatively healthy or if there's a presence of quite a lot of non-communicable diseases and chronic diseases. It's also related to how quickly people seek care. And what we know in this pandemic is that if people are at risk of severe disease, the earlier they seek care in terms of medical care, the better their outcomes are. And then finally, it's also, of course, related to the level of care provided to patients and the ability of hospitals and health systems to update their clinical management protocols with our new knowledge. With every day we're learning new things. Every day we're looking at new guidelines for clinical management protocols. Every day we're hearing about potentially new treatments for COVID-19. We have some very clear recommendations. We have some very promising trials with various antivirals and other treatments that will enable us to bring mortality down. And yes, that will be something that we look at, but we urge countries and public health systems to not wait until the pandemic is over to look at these things, but to look at it every day and make those adjustments every day. So it's very hard to understand why some countries have done better than others, but it's really a range of reasons, and no country has had an easy time here. So I wouldn't compare one country against the other.
Dr. Smolvud, thank you very much for this interview.
You're very welcome. Thank you.